1. During a complex procedure, the Certified Surgical First Assistant, CSFA, must evaluate the surgeon's cues. Which adult learning principle best supports adapting communication in real time? A. Behaviorism. B. Andragogy. C. Constructivism. D. Operant conditioning. 2. When mentoring a new surgical assistant, the CSFA should prioritize which evaluation method to provide the most accurate feedback on technical skills. A. Peer survey. B. Direct observation. C. Written exam. D. Case study review. 3. In curriculum development for CSFA training, which component ensures alignment with regulatory compliance standards? A. Interactive role play. B. Learning objectives. C. Student evaluations. D. Mentorship logs. 4. Which communication strategy is most effective when instructing surgical residents on intraoperative techniques? A. Giving lengthy lectures. E. Closed-ended questioning. C. Demonstration with guided practice. D. Independent reading assignments. 5. A CSFA is mentoring a peer. Which approach supports adult learners' motivation? A. Assigning repetitive drills. B. Encouraging self-directed tasks. C. Imposing rigid memorization. D. Limiting collaborative learning. 6. When evaluating performance in the operating room, which formative assessment is most beneficial? A. Annual certification exam. B. Daily reflective journaling. C. Intraoperative feedback. D. Written self-assessment only. 7. Which regulatory body most directly influences standards for CSFA practice in the United States? A. FDA. B. OSHA. C. nbstsa. D. WHO. 8. While developing a new module for surgical assistants, which adult learning principle ensures relevance? A. Prior experiences should be integrated. B. Rote memorization is essential. C. Learning should be abstract only. D. Assessment outweighs application. 9. Which mentoring strategy helps reduce performance anxiety in novice surgical assistants? A. Public criticism. B. Constructive private feedback. C. Ignoring mistakes. D. Assigning independent tasks prematurely. 10. During a skills evaluation, a CSFA should prioritize which aspect of communication? A. Technical terminology only. B. Clarity and conciseness. C. Passive observation. D. Minimizing dialogue. 11. Which type of evaluation best measures a surgical assistant's ability to apply knowledge in the operating room? A. Oral quizzes. B. Practical simulation. C. Multiple choice exam. D. Peer presentation. 12. Which curriculum design model is most appropriate for CSFA continuing education programs? A. B. Bloom's taxonomy alone. C. Socratic questioning only. D. Memorization framework. 13. A CSFA provides feedback immediately after an error. Which principle of adult learning is applied? A. Delayed reinforcement. B. Immediate relevance. C. Passive absorption. D. Extrinsic motivation only. 14. When designing a skills workshop, which evaluation method ensures hands-on mastery? A. Written survey. B. Role-playing scenarios. C. Theoretical discussion. D. True-false test. 15. Which mentoring approach fosters critical thinking among new assistants? A. Spoon-feeding information. B. Asking reflective questions. C. Assigning irrelevant tasks. D. Encouraging passive listening. 16. Which regulatory guideline emphasizes patient safety in surgical first assisting? A. HIPAA. B. OSHA Bloodborne Pathogens Standard. C. Stark Law. D. Fair Labor Standards Act. 17. What communication technique ensures effective handoff between a CSFA and the surgical team? A. Storytelling. B. SBAR format. C. Extended narratives. D. Silent observation. 18. In curriculum development, which factor best supports competency-based training? A. Seat time requirements. B. Mastery of objectives. C. Uniform pacing. D. Random assessments. 19. Which evaluation tool is most valid for measuring intraoperative problem-solving skills? A. Checklists. B. Case-based scenarios. C. Self-report questionnaires. D. Attendance logs. 20. A CSFA mentoring relationship should be primarily built on A. Directive command. B. Mutual respect. C. Peer competition. D. Hierarchical distance. 21. Which adult learning strategy enhances engagement in CSFA workshops? A. Passive listening. E. Interactive case studies. C. Memorization drills. D. Reading textbook excerpts only. 22. Which type of assessment is most effective for gauging long-term retention in surgical techniques? A. Cumulative simulation exam. B. Daily attendance log. C. Peer-written essay. D. Satisfaction survey. 23. In developing an instructional plan which ensures compliance with accreditation requirements. A. Following national standards. E. Adding instructor preferences only. C. Ignoring documentation. D. Prioritizing popularity of topics. 24. Which principle supports the use of prior surgical experience in learning new techniques? A. Experiential learning. B. Behaviorist conditioning. C. Tabula rasa. D. Structuralism. 25. Which communication barrier most often affects team dynamics in the OR? A. Overclarification. B. Ambiguity. C. Visual cues. D. Structured feedback. 26. Which evaluation technique is most reliable for certifying readiness to practice as a CSFA? A. Self-reflection. B. Peer rating. C. Objective Structured Clinical Exam, OSCE. D. Lecture attendance. 27. A mentor encourages the learner to set personal goals in the OR. This reflects which principle? A. Learner autonomy. B. Teacher-centered instruction. C. Passive dependency. D. Hierarchical dominance. 28. Which regulatory standard ensures infection prevention compliance? A. HIPAA privacy rule. B. AORN guidelines. C. Stark Law. D. Affordable Care Act. 29. Which adult learning method best engages practicing surgical assistants during continuing education? A. Group problem solving. B. Memorization drills. C. Dictation exercises. D. Passive note-taking. 30. A CSFA assesses communication skills of a learner by A. Testing knowledge of anatomy only. B. Observing team interactions. C. Reviewing medical charts. D. Assigning silent study. 31. Which curriculum element promotes measurable outcomes? A. Learning objectives. B. Instructor preferences. C. Random topics. D. Daily attendance. 32. The best feedback style for mentoring surgical assistants is A. Vague encouragement. B. Specific, actionable suggestions. C. Generalized praise. D. Nonverbal approval only. 33. Which regulatory agency mandates safe handling of sharps? A. OSHA. B. CMS. C. DEA. D. NIH. 34. Which evaluation method ensures both knowledge and skill are measured? A. Multiple choice exams only. B. Practical simulations plus written test. C. Peer surveys only. D. Attendance tracking. 35. What communication principle is key to avoiding surgical errors? A. Assumptions. B. Closed-loop communication. C. Silence. D. Excessive jargon. 36. Which mentoring style best develops independent judgment? A. Directive, micromanagement. B. Collaborative problem solving. C. Passive observation. D. Isolated instruction. 37. Which adult learning strategy is most effective in developing leadership skills among CSFAs? A. Role modeling. B. Rote memorization. C. Textbook summarization. D. Lecture-only sessions.